Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Sayyid Ali Hussain and today we are going to talk about how to calculate the exercise heart rate. This lecture is going to be very helpful for those who are working with cardiac population or cardiac patients or those who want to improve their cardiorespiratory endurance. So let's start with the lecture. The main purpose of this lecture is to determine the exercise heart rate for any type of patient or any age group. There are three categories of the patients. If somebody is suffering from cardiac disease, we can categorize them as low risk, moderate risk, or high risk patients. Now, what are low risk patients? Those who don't have any symptoms. The cardiovascular risk factors, they are equilibrated. That means that there is a balance between the risk factors and the management. Their ejection fraction is more than or equal to 50%. There is no complex ventricular arrhythmias at rest or during exercise. There are normal exercise hemodynamics, that the blood pressure, it remains within the normal limits. No ischemic changes, no significant coronary artery stenosis, and the functional capacity is equal to or more than 80% of the predicted value, and they can perform more than 7 METs. So these patients were the low risk. Now the moderate risk patients are those who have ejection fraction ranging from 40 to 49%, mild or moderate sign of ischemia at high level of exercise. They can have significant coronary artery stenosis. Their functional capacity can range from 70 to 79% of the predicted value, and they can perform less than 5 METs. There is no ventricular arrhythmias at rest or during exercise, and the normal exercise hemodynamics. Lastly, we have high risk patients. Mild symptoms at low level of exercise, even less than 5 METs. There is a history of cardiac arrest, complicated myocardial infarction or revascularization procedure. Ejection fraction is usually less than 40%, and there can be complex arrhythmias at rest or during exercise. And there are abnormal exercise hemodynamics as well. Their functional capacity is reduced to less than 70% of the predicted value. Now, how we are going to measure or calculate the exercise heart rate for any patient or for a normal person who wants to develop or increase the cardiorespiratory fitness? The formula is called as Karvonen Formula. It is very simple. The first step is to determine the heart rate maximum, which is determined by subtracting the age from 220. Then you have to measure the resting heart rate for 1 complete minute. After that, you need to take or measure the heart rate reserved. It is very easy to measure the heart rate reserved, and that is by subtracting the maximum heart rate, subtracting the resting heart rate from the maximum heart rate. And then you may take 50 to 60% of exercise heart rate reserved, and then you can calculate the exercise heart rate. This is very easy to perform, so we will execute this in the next example, and then it depends that how we calculate it or for which population we are going to calculate it. This is important to remember that 50 to 60% of the heart rate reserved can be for moderate risk of patients. For mild, it can be from 60 to 70% of heart rate reserved, and for severe or high risk patients, it can be from 40 to 50% or even less than that. So how it is calculated? It's very simple, so we will do it. Now let's take my example. I don't have any cardiac issue, so my age is 36 years. So from 220, I'm subtracting my age. That makes heart rate maximum, that is 184 beats. My resting heart rate is 72, so I am subtracting the resting heart rate from the heart rate maximum to achieve my heart rate reserve. Now this is my heart rate reserved. I need to take 65 to 75% of the heart rate reserved. So it's Why? Because I don't have any cardiac issues yet. So what I'll do, I'll multiply 0.65, because this is 65%, with 112. That makes 72.8 beats, and 75%, that means 0.75 multiplied by 112, that makes 84 beats. So 65 to 75% of my exercise heart rate is about 145 to 156 beats per minute. If I'm exercising in this range, I'm not at risk of developing any cardiac pathology or any arrhythmias or any complications, any ischemia in my cardiac muscles. But if I go beyond this 156 beats, I may fall in the category of risk. Or if I perform my exercise below 145 beats, then there will be no benefit to my cardiorespiratory system. So in order to benefit my cardiorespiratory system and improve my cardiorespiratory endurance, I need to work within the heartbeats of 145 to 156. And for the very same reasons, the exercise cycles, ergometers, or treadmills, they have these sensors to measure your heart rate. So you first have to measure your heart rate using this formula, and then you can perform the exercise effectively and safely. If you have any questions, feel free to ask me. Thank you very much.